Last week, I was discussing with a friend concerning the content of a conference I attended, organized to mark the World Diabetes Day. And suddenly my friend said, "Thank God he's safe from diabetes because he doesn't consume sugar." Is this statement true? Welcome to another episode of Your Health Matters. My name is Aminat Adeyemo, and I thank you for joining me. Today we shall be looking at diabetes mellitus. We'll be discussing what diabetes mellitus is, the causes, the predisposing factors, and more importantly, how can it be prevented? What is diabetes mellitus? Diabetes mellitus is a disease that prevents the body from properly using the energy from the food we eat. It is a disease usually referred to as high blood sugar in our own community. And this happens in just two occasions. Number one, when the pancreas, which is an organ in the body, is producing little or no insulin at all. And what is insulin? Insulin is a naturally occurring hormone which helps the body to use sugar. And secondly, diabetes mellitus can occur when the pancreas makes insulin, but the insulin is not working. So let's break this down a little. Normally when we eat, most of the food is broken down into simple sugar known as glucose. So whether you eat rice, beans, eba, pounded yam, amala, name it, they are broken down into glucose. This sugar called glucose needs to enter the body cells for it to be converted into the energy that we need. However, this sugar can't go into these body cells by itself. Insulin helps in doing this. So when sugar leaves the bloodstream and enters the cells, the blood sugar is lowered. So there is no high blood sugar. That is the normal process. But when there is no insulin, sugar can't get into the body cells for use as energy. And this leads to a rise of sugar in the bloodstream. Then there is high blood sugar. Also, people can develop diabetes mellitus as a result of pregnancy. And this is usually called gestational diabetes mellitus. So, having known this, what are the symptoms of diabetes mellitus? The individual might experience an increased thirst, an increase in hunger, dry mouth, or unexplained weight loss. They might also start feeling weak or tired often, or get frequent yeast infections or urinary tract infections. So if you are experiencing any or a combination of these symptoms, please present yourself in the hospital and get checked. Early detection saves lives. Diabetes mellitus is manageable. So what predisposes us to developing diabetes mellitus? And how can we prevent this? The number one on the list is the family history of diabetes mellitus or a personal history of gestational diabetes. Again, you must know what your parents are being managed for. What are the diseases that run in your family? This makes you to be proactive and gives you an ample time to take necessary actions concerning your health. Injury to the pancreas is another factor. And this can be in form of infections, tumor, might be accidents, or even surgery. And it is worthy of note also that your risk of getting diabetes mellitus increases with age. As you get older, so is your risk of having diabetes mellitus. There are other controllable factors that can lead to the development of diabetes mellitus, and these include high blood pressure. People who are hypertensive are more likely to have diabetes mellitus, so manage your blood pressure. An increase in blood cholesterol level is another factor. Eat more of fruits, vegetables, and diets that are low in fat. Do you still smoke? Then quit smoking to avoid developing diabetes mellitus. Being overweight is another factor. Ensure you maintain an optimal weight. Exercise your body regularly and avoid sedentary lifestyle. Finally, it is important to know that sugar itself doesn't cause diabetes mellitus. However, eating a lot of sugar can cause tooth decay. Therefore, moderation is key. And if you have been diagnosed already of diabetes mellitus, kindly comply with your physician's recommendations. If you have learned something from this video, kindly subscribe to this channel and share with your loved ones. And until the next time on this channel, Aminat Adeyemo is my name. And always remember that your health matters. Bye.